Welcome back. As I said, do we have new people participating? Yes, raise your hands. Thank you. Then we will be assigning you to a group later. So your group leader is going to keep up or give you an update. You know, you get every week we have a handout. So you're going to get your handout for the first week. So we're going to be talking about exercise and the word metabolism. You heard about that, right? It's how our body handles food to help us be what we want us to be, okay? But again, let me just reinforce that this talk is not to help you diagnose or treat your diseases, okay? For those who have chronic diseases, I remind you to let your doctors know that you are going to be undergoing this program, because if we follow this to the T, medications need to be adjusted, okay? Just a reminder. Amen. So, what is metabolism? It's how our body handles food. That's just one part of metabolism. There are two main parts, but we're just going to talk about how our body handles food, that part of metabolism, okay? So food goes into our body through our mouth, and the drinks that we do gets mixed into our stomach and actually sterilized. Our stomach is made by God to have acid, to kill the bacteria, the fungus, and the virus that's not intended to be part of us. So remember, our stomach has acid to sterilize and clean it, and then it's going to be digested and absorbed into our intestine. So after it's absorbed, what happens to the food? It turns into fuel or heat in the body. It produces heat. So the energy stored in the food is now available for our muscles to use. You know, the bigger the muscles, the bigger the fuel that it needs, right? When our walking legs, that's the biggest muscle. And the arms, whatever we do with our arms, we are using food to fuel that. So, if we have a similar daily routine, our weight will be the same, okay? If it may be stable and the same weight, excess body weight, or stable, normal. And that depends on what we do, okay? So if we eat more than what our body needs as fuel, it turns into fat, okay? Stored. So, and if weight loss usually happens when we eat less than what we need, okay? Because when we eat less, our body has the chance to turn that excess body fat into fuel. But remember, in order for the body to use that as fuel, we need water. Because every chemical reaction in our body needs water. You know, it needs vitamins, minerals, but the constant need of the body is water, all right? So if we want to use our excess body fat as fuel, make sure you drink enough water. And I am glad you have water bottle in your table. And that is the best time to drink water, is in between meals. Remember I said the stomach has acid to break down. If we drink a lot of water during mealtime, we are diluting the acid that's needed to break down our food, especially protein. So the best time to drink water is in between meals. So the body doesn't like to, although I said if we eat less, our body is going to use the excess body fat, right? But typically our body doesn't want to melt away that fat. So we have a lot of defenses that slows down the weight loss if we eat less. So one of the things that the body uses if we eat less, initially it will work for maybe two weeks, but after that the weight loss will slow down because the body has mechanisms to prevent weight loss. Like the body's metabolism goes down, okay? And then our temperature goes down. So if we are, temperature is lower, it saves more energy, okay? We sleep longer, or we don't do work as much. We walk and, do things slower. That's to save energy. So that's why any diet will have a weight loss plateau. When you're following a weight loss diet, usually it has a good benefit in the first 2 or 4 weeks, 6 weeks, and then after that it stops. If you know what I mean, right? Because our body wants to keep that. Yes, sir.
So, that's the saying, hopefully, I'm getting. If we exercise more, metabolism goes up, and you burn more energy, you burn more food.
That's right.
So you lose more weight. But if you don't, and you're still doing the same diet, but you do less work or energy, you burn that, the body starts to save that energy, and you slow down.
That's right. Everybody heard that? So what he's saying is, when we exercise, the metabolism goes up. But then if we don't exercise and eat the same thing, the metabolism goes down. So now that's why we're talking about exercise and metabolism this time, okay? So if we don't exercise and even if we eat less, the weight loss will plateau, okay? Because again, our body has a lot of mechanism to prevent weight loss. Because in the very beginning, food is not really like overabundance as this time, right? Our ancestors has to gather food. So the one who created our body has a lot of mechanism to prevent weight loss. Okay? So that's why we easily gain weight. Does that make sense? Okay? But for those who have tried to lose weight with the different diets, or skipping meals, or eating less, did you find yourself not losing weight still?
No.
Because a lot of my patients will say like, Dr. Florida, I hardly eat now. Why am I still not losing weight? Let me explain why, okay? So our body is made up of cells. And this is the cell wall of our body. And every time we eat, our body produces insulin from the pancreas. Have you heard about insulin, right? Insulin is like a key that docks into the receptor, which acts like a door, okay? So every time we eat, the body tries to convert it to glucose to get inside a cell, and especially in the muscle to burn as fuel, okay? So every time we eat, the pancreas produces insulin, acts like a key so that glucose can get in and be used as fuel, especially to our muscles, right? So what happened? This is what happened when we are healthy. Insulin docks in, door open, glucose used as fuel. Type 1 diabetes is when the body doesn't produce insulin, okay? But now, if we have type 2 diabetes, we eat food, turns into glucose, we give ourselves insulin because we don't have enough insulin, but the receptor, the lock is clogged. So even if you have a lot of keys, it doesn't fit in. So that's why even if, you eat less, and the body also, God made our body. If we eat less, our liver actually produces glucose for us. Okay, so that's why when there are diabetes that even if they don't eat, their blood sugar is still high because our body is made in such a way to produce something. Okay? But that excess glucose still is not able to get inside a cell because the door key doesn't get into the lock because it's clogged. And do you know, it's called insulin resistance or uncontrolled diabetes. So this is what's also going on with our fat tissue. So if we do not eat the right food to unclog this here, no matter what we do, it's still difficult to lose weight. So you know what clogs this? Is fatty fat, excess triglycerides, excess cholesterol, okay? So the best way to eat is eat low-fat, high-fiber vegetables, okay? So far? So even if we eat less or it needs to be the right quality. So it's not just the quantity, but the quality. What that is high in fibers, because fibers, what does it do? It sweeps away the clog. Okay? So fibers in what you're eating. Okay? And naturally, the fibers that are, if your food is high in fibers, it is low in calorie too. So it works hand in hand. Okay? So when we eat less, especially, and then we add activity, then that will burn the excess body fat. All right? So the best way program has found out, or over and over result is even 30 minutes of walking a day makes a big difference. And I know there are some of us is having trouble walking even for 5 minutes. But take heart, you don't have to walk 30 minutes right away, okay? For those who have difficulty. What you can do is just improve your physical activity from where you are. So if you can only sit the whole, most of the time you're sitting the whole day, you just can't, if you can just stand up every hour during the day. So that's essentially increasing your physical activity from what your baseline is. And eventually, you will be able to do the walking. Maybe 5 minutes this week, 10 minutes the next week, right? So don't worry if you cannot walk that much yet. So the magic of exercise is no diet, no exercise. What happens? Slowly gain weight, right? Because you can see, like, when we are, from starting age 40 and now, we just slowly increase in weight, even though we eat the same amount, right? A lot of my patients are like, I never changed my eating since I was, 20, same way of eating. But why is my weight just continuing to go, okay? So diet, but no exercise, limited success. Again, just maybe a few weeks. But diet plus exercise, long-term success in keeping off the the excess body weight. But remember, I do not want us to stick on the word diet, because diet is short term. We want to know fueling our body right makes it sustainable for life. Okay, so what are the benefits of exercise? As I said, sustained weight loss and, lower blood pressure. From our studies, thank you so much, Mary. Have a wonderful day. So, studies after studies showed us that even if you just lost 5 to 10% of the weight, blood pressure gets better. Okay? Low bad cholesterol, the LDL, gets better. And lowers the risk of heart attacks and strokes and the other complications of obesity, even pain, When we have arthritis and we have excess body weight, for every 10-pound excess in body weight, the knee feels it like it's 40 pounds more. Okay? So just imagine if you lose 10 pounds, the knee will be so happy because it feels like it lost 40 pounds. Okay? So eventually the pain will be less. Correct? Amen. So, stronger bones. And you know what? When we exercise, we also produce hormones that keep us happy. We call that hormones endorphins. And so our mood will be better, our anxiety and depression will be less, and we have better relationship with the one above and with the people surrounding us, especially our family. And you know what? Exercise can also be a family thing. Me and my husband just started walking after dinner, at 6, 7 o'clock when it's not too hot. You can walk for 10, 15 minutes. And it's not just for your own health, but for relationships too, right? Having a workout or exercise partner. And we are going to look at a benchmark study on exercise, okay? So this is a study of almost 72,000 female nurses. They were healthy, aging from 40 to 65, and they were followed for 8 years. And for 8 years, there were 645 heart attacks. And they calculated the activity that they did. And so they were divided into 5 groups based on how much exercise they did. And they were nearly 15,000 per, there were nearly 15,000 in each, group category. So there were higher heart attacks in people that has exercised less. Okay? So there were 178 heart attacks in those with the least exercise compared with 89 to those who exercise more. So they counted the heart attack risk of those with the least exercise as being 1, okay? And then they are compared to the group with the higher exercise. So those who had done mild exercise had a 30% risk reduction in heart attacks. And look, those who exercise most have 54% reduction in heart attack. So they also did the same calculations, just looking at how much steps people are walking. So the first calculation is a little bit of exercise compared to the vigorous exercise. And now they just look at walking, okay? So people who walk, there were nearly 50,000 persons per year of observation, and in each 5 groups. person years is the sum of the time in years, and they walk. So the metabolic equivalents of walking were much more modest in those who had vigorous forms of exercise. So you see, the ones who have the least steps, they have heart attacks of 92 events, and the ones who had more walking, 51,000 steps compared to 46,000 steps, they have less heart attacks. So the same thing, the least walking amount is assigned 1, and then the more walking has a reduction of 54% in heart attacks. So what we're saying here is, even just walking, increasing your walking, can decrease your heart attack incidence by 54%. Okay? So, let me give you a comparison. You know what we use as doctors to prevent heart attacks is statin. You know what I'm talking about? Atorvastatin, cholesterol lowering medications. Guess what? I asked Google yesterday, what is the percentage of decreased risk for heart attacks with statins, okay? So it claims 25 to 37. You see, it's lower than exercise. And you know what comes with statin? The side effects, right? One of the side effects, that's another topic, right? But you can see how good is exercise when you couple it with the right quality and quantity of food. These are the natural things that our Creator gave for us. Isn't that a wonderful news? Okay, so walking provides the same benefit as more strenuous forms of exercise. This is such a good news for those who have a lot of pain right now that they cannot do exercise. I become an obesity specialist because I was just first a rehab doctor. So people come to me for consultations because they have back pain, knee pain, and hip pain. And as a rehab doctor, I send them for physical therapy. More than half of them comes to me and says, Dr. Florida, you're making my pain worse. Like, oh no, that's not what I meant. And then I come across into a doctor who specializes in obesity medicine, and he told me, look into it. And then when I did a specialization in obesity, I learned that before I send my patient to do strenuous exercise, I have to tell them to eat good anti-inflammatory foods at least for 2 weeks. Because when you have excess body weight, your body is naturally inflamed. And then when you are already in pain, you do a lot of exercise, you're just multiplying your pain. But before you do the exercise, you eat anti-inflammatory foods. We're going to talk more about it when we are going to food section in this topic, okay? So hold your horses about food because we will have a lot about that, what are anti-inflammatory foods. So it's good to fuel our body with a good quality anti-inflammatory foods before we even start increasing or having a vigorous exercise, okay? So, the risk of coronary events by pace of walking. So, don't worry if you are only able to walk slowly this time, because eventually you will be better, maybe in a month or 2 or 3, or even in a year. But take note, the speed of less than 2 miles per hour still decreases your risk, okay? But if the more fast you can walk, the more risk reduction. So it's really good because it's dose dependent, okay? Okay. So another study about cancer. So it's not just about reduction of heart attacks. It's also reduction of cancer. And they did this for esophagus, cancer of the stomach. They did this for cancer of the breast and colon. So risk of leukemia, the blood cancer, it's decreased by 15%. Liver cancer by 25%. So, exercise and breast cancer survivor. Although this is a small study of 315 women, just over, postmenopausal women, and had experienced early stage of cancer, breast cancer. Early stage. And they were followed for 2 years or 8.7 years. There were 45 deaths, only 5 from breast cancer. Okay? So, even the survival rate is affected. Because you may survive breast cancer, but if you don't do exercise and you don't do continuous good quality of eating, you can still, die early with that. But if you do both, good quality of fueling and exercise, you will lessen the mortality rate or death rate early on. So even moderate exercise after diagnosis of early stage breast cancer reduces the risk of dying by 42%. So, this is for women or for aged person, 72 years old, measured by number of steps, followed for 4.3 years. And look at that. The risk of dying early is decreased by over 90% from walking less than 2,000 steps per day to walking more than 7,000 steps per day. You decrease the risk by over 90%. So a lot of us have phones or a smartwatch that you can see how many steps you are, right? So the steps that are considered active, equivalent to going to the gym and doing moderate intensity exercise, is 10,000 steps. So this 72-year-old women are just walking 2,000, less than 2,000 to 7,000. Where was I? To more than 7,000 steps, the decrease in mortality is more than 90%. So what I'm saying here is trying to emphasize is just do what you can and eventually it will get better. So the study was a review of data from 15. This study, a review of 15 prospective studies. So 15 different studies that were following the participants for 15 studies. And so they see people with excess body weight normally have excess body fat, right? But our body is usually composed of muscles, bones, and fat. So when we eat less, we lose fat and we also lose muscles. But when we eat less and do exercise, we preserve muscles and lose only fat, the one that we don't need, right? So exercise also is good in preserving muscles. Muscles is our friend because that's the one that makes us strong and helps us prevent diseases. So A review of this article on the relationship of exercise and weight loss showed us that a combination of diet and exercise is so much better, right? So if you have, your steps counted, and if you do aerobic exercise, it needs to be extreme in order to lose weight. Resistance training here, it says no weight loss, because resistance training can make you gain muscles. And muscles weigh more than fat. Aerobic and resistance training, lose this much weight, but needs to be extreme. But look at diet and exercise. A lot of weight loss, right? So why is that? Because we are meant to move, right? God gave us hands and feet for moving. So knowing this, let's also tell our young ones to keep moving, not just to keep on being glued to our phones. Our younger generations, because what they are right now, they will eventually what they will become later. So now that we adults are learning this, it's very important to keep our young ones to be moving, okay? So activity and weight loss, there is a dose-response effect of physical activity on weight loss. So less than 150 minutes per week, little or no weight loss. More than 150 minutes is, it's dose dependent. So this is the guidelines for the American physical activity guidelines for Americans. Adults should move more and sit less throughout the day. 150 minutes is actually what's recommended to be healthy. In order to lose weight or to maintain weight loss, we need 300 minutes per week, not per day, per week, okay? So 150 minutes, which is required to maintain good healthy weight, it's 30 minutes, 5 days a week equals 150. So when we are going to be losing weight and less pain as we get better with our exercise, to prevent muscle loss, then we need to do resistance training at least 2 times a week. Weights or resistance bands. So aerobic activities, also called endurance or cardio activities, are physical activities in which people move their large muscles in rhythmic manner. The biggest example of that is walking, right? Large muscles and repeated activity. So these are examples: walking, swimming, slow stair climbing. If you have a lot of pain and you have high blood pressures, do not do these strenuous activities for now, okay? And if you have any symptoms, shortness of breath or rapid heartbeat when you exert a little bit of exercise, please go see your doctors first to get clearance to do more, especially the vigorous exercises. And in the group meeting later on, you will learn how to get your pulses so that you can actually monitor yourself. If you do a little bit of strenuous activities, if your heart rate goes so fast, you got to see your doctors first before proceeding, okay? So, safe and effectiveness of exercise, especially for walking, light exercises. Make sure you dress appropriately, especially for summertime. Don't overdress. Wear good shoes. Get familiar of how to monitor your heartbeat. And make sure when you perspire, and you're not used to exercising a bit, so just perspire a little bit, not a whole lot, at the first few exercises that you undergo. And when you perspire, make sure you drink your water. So, to get your target heart rate is deduct your age from 180, and that should be your target heart rate when you exercise. All right? So for instance, if you're 50 years old or 45 years old, 180 minus 45, so your target heart rate is 135. So that's the heart rate that you want to move to get your body to actually increase its metabolism. So the data here show that the more you walk each week, the more weight loss you have, okay? So as we said earlier, 300 minutes per week can lose as much as 12% of the weight. You know, weight loss medicine can only make you lose weight 5 to 18%. And the 18% are the ones, those injectables. The regular weight loss medicine can only do 3 to 5%. But there's no limit to your weight loss when you exercise and eat the right quality and quantity. And it's free with no side effects. So don't forget to avoid snacks in between meals. Eat your breakfast. It's the most important meal of the day still, because it fuels your body for the whole day that you are walking and moving. As much as possible, eat less for dinner, or that's the thing that you skip. And then pray for motivation and strength. First thing in the morning, go for strength from Him. And before you go to bed or sleep, thank Him. And in between, keep talking to Him. And also contact your group leader. All right? You can make an arrangement. Even texting your group leader can help you get motivated. And then read your assigned Bible verses or whatever helpful, reading that you can do. But it's very convenient. In your handouts, there is a verse that you write it in the morning, you meditate it for the day, and that helps you to be more successful. So remember, when you walk 6 days a week, you can get a credit of walking for 7 days. And if you avoid the food item that you only ate it once, for instance, I wanted to avoid added sugar, and I had a Snicker on Wednesday because I was a little bit stressed at work. There was so much things to do, and I said, I really want to have one Snicker. So I ate one Snicker, the mini one, because I'm so tiny, right? And today, when we had our memory verses, we did our memory verses for this week, and there was a tiny Oreo Snickers bar kind of combination, right? And I said, I was about to get mine after I did my memory verse. But I said, I already had it for the week. So there is always temptation. We know that every day we make decisions. More than 100 decisions every day. Either knowingly or unknowingly. But we are to practice making the right decisions, not just in big things, but in little things. And because the decisions for what to fuel our body is actually the ones we're making every day, more of them. Okay? So don't forget to carry your card. I bring it to work so I can remember to score the card.